Bismillahirrahmanirrahim. Today we are going to discuss the colonic polyps. The colonic polyps or colorectal polyps are very common, and most of the time the colonic polyps, they do not produce symptoms. But the major concern with the colonic or colorectal polyps is that these polyps initially as benign growths may transform into malignant growths and cancers. So what is a polyp? It is actually a clump of cells that result from the overgrowth of epithelial cells and sometimes into tissue masses that are bulged out and protrude into the lumen of the gastrointestinal tract. Polyps may occur in the esophagus, stomach, and small intestine also, but the common site is the large intestine or colon and the rectum. We know that the lining epithelium of the gastrointestinal tract is composed of the cells which are labile cells. By that we mean that the old cells continually shed and are replaced by the newly forming cells by the differentiation of the mature cells or new cells that comes from the stem cells that lie in the crypts of the intestine. Actually, this mass of tissue in the form of a polyp is caused by genetic mutations. We know that the cell cycle is a very regulated process and there are genes that control the proliferation of the cells. But if at any site of the colon such genetic abnormalities or mutations occur in the genes that are associated with the cellular proliferation, it may result in uncontrolled proliferation of the epithelial cells, and the balance between the cells that are shed off and the formation of new cells is disturbed. And excess proliferation of the new cells may form an overgrowth of the epithelial cells, which may bulge out and may protrude into the lumen of the colon. So the two types of the polyps are sessile polyps and pedunculated polyps. The sessile polyps are those that have a broad base and are firmly attached to the lining mucosa of the colon. While in pedunculated polyps, the polyp form a stalk for its attachment to the lining mucosa. This stalk results from the proliferation of the cells that are adjacent to the polyp and by the traction that the polyp exert by protruding into the lumen. So the pedunculated polyps are those in which the polyp is attached by a stalk to the lining mucosa, while in sessile polyps the base of the polyp is broad and it is firmly attached to the lining mucosa of the colon. Polyps are more common in people of more than 50 years of age, people that are obese, the smokers, And the family history is very important for the colonic polyps. If someone has a member of his family who suffered from colonic polyps, he is comparatively more susceptible to the development of the colonic polyps. The major concern of the colonic polyps are that most of the time these polyps they do not produce symptoms, and they are found incidentally when we are doing colonoscopy for some other disease. We may see the presence of the colonic polyps. But the major concern with the colonic polyps is that some of the polyps carry high potential for transformation into malignant tumors. So we divide the colonic polyps into those with high neoplastic potential and those uh, with little or non-neoplastic potential. So the neoplastic polyps are the major neoplastic polyps is the adenoma, which is the benign tumor of the mm, uh, large intestine. And this adenoma or adenomatous polyps carry high potential for malignancy. And again, this depends upon the size of the polyp or polyps. Large size polyp carry high risk of becoming malignant. The non-neoplastic polyps are divided into three major types. Inflammatory polyps, as the name indicates, when there is an associated inflammatory reaction. Hyperplastic polyps, which result hyperplasia of the mucosal epithelial cells, and the hematomatous polyps having disorganized and distorted architecture. The hyperplastic polyps are the second most common polyps of the colon. The first one are the adenomatous polyps, and the hyperplastic polyps actually result hyperplasia of the normal mucosal epithelial cells. We know that the old epithelial cells are continually shed and new cells are formed from the mature epithelial cells, or they may be derived from the stem cells that are located at the base of the crypts, intestinal crypts. So in conditions when there is decreased or delayed shedding of the surface epithelial cells, and if there is excess formation of the new cells, so the new cells they may outnumber the cells that are shed, and they may grow in the form of crowding, which consists of the absorptive intestinal epithelial cells and may also contain the mucus secreting mature goblet cells. Hyperplastic polyps usually have the form of serrated polyps having saw-like tooths in their surface architecture, and the hyperplastic polyps comparatively are more common in the left colon. The hyperplastic polyps are considered to be benign growths. However, the risks for malignancy cannot be totally excluded. The inflammatory polyps, where an element of inflammation is added, they are most common in, for example, the solitary rectal ulcer syndrome, in which a single rectal ulcer occur in the rectum, and the other conditions that are associated with inflammatory polyps include the inflammatory bowel diseases, ulcerative colitis, and the Crohn disease. The exact pathogenesis of inflammatory polyps and hyperplastic polyps is not very clear, but in case of inflammatory polyps, what happens that there are repeated bouts of inflammation and healing in the form of a chronic inflammation. So, as a reaction of the mucosa to these repeated bouts of injury and healing result in the form of a polypid mass. And this polypid mass consists of the reactive tissue and inflamed mucosa. The hematomatous polyps are disorganized, distorted, tumor-like growths. Initially, the hematomatous polyps are also benign. But as we know that in a hematoma, the cellular architecture is so much distorted and disorganized that it may be considered as a polyp, and sometimes it may be a precancerous condition. There are two types of hematomatous polyps with disorganized and distorted architecture, and the hematomatous polyps may occur sporadically. By that we mean here and there and rare. But they are sometimes associated with syndromic conditions. One syndromic condition is the juvenile polyposis syndrome, in which a child is born with an autosomal dominant type of inheritance for genes that are concerned with the cellular proliferation. The juvenile polyps are mostly located in the rectum, and they are sometimes associated with ulceration and bleeding. The juvenile polyps may occur also sporadically, or they may be concerned with the syndromic diseases like juvenile polyposis syndrome. The hematomatous polyps that are associated with juvenile polyposis syndrome mostly occur in children younger than 5 years. The second syndromic polyps are associated with post-Ziegler syndrome. This syndrome was described by the two scientists, the Post and the Ziegler, and it has got its name as post-Ziegler syndrome. Post-Ziegler syndrome commonly occur at the ages of 10 to 15 years of age, and it is just like juvenile polyposis syndrome. It is also a genetic illness, and the mutated genes are inherited from the parents to the offsprings, and it is also an autosomal dominant condition. By what we mean that only one copy of the mutated gene is sufficient to cause the disease. Patients having hematomatous polyps associated with post-Ziegler syndrome also have deeply staining melanotic macules, particularly on the mouth, lips, genitalia, palms, and sometimes soles. And the major concern is the presence of the hematomatous polyps in the colon. The most important and most common polyps are the adenomatous polyps or colonic adenomas. As we know that adenoma is a benign tumor of the glandular tissue, and so these are the benign outgrowths of the colonic epithelial cells. And the colonic adenoma carry high risk of malignant potential. And this depends on the presence of the epithelial dysplasia. We know that initially in a tissue before neoplastic transformation, it undergo dysplasia, and this dysplasia may be low dysplasia, intermediate dysplasia, and high-grade dysplasia, when the cells cannot be compared to the original cells from they are derived. So dysplasia describes the structural and functional disorientation of the dysplastic cells, and they are not as similar as the original cells from which they are derived, and this lack of differentiation range from low-grade dysplasia, moderate dysplasia, and high-grade dysplasia. So the colonic adenomas are the colonic adenomatous polyps. They carry high risk of malignant potential. Histologically, the adenomatous polyps are classified into tubular polyps, which are usually pedunculated, having a stalk, and they are composed of tubules, and these tubules on the cross section appear in the form of hools. The second type are the Willis type, in which the polyps appear in the form of tree-like branches, and actually these are sessile and they do not have a stalk and are firmly attached to the lining mucosa. The third type is the tubulo-villous type of polyps, which is a mixture of the tubular and the villous types of polyps, and it contains the tubules and branching tree-like architecture. And the fourth type of polyps, adenomatous polyps, are the serrated polyps, which appear having the structure of the teeth of a saw, and they are firmly attached to the underlying lining mucosa. Now, if we consider the malignant potential of the adenomatous polyps, so the size matters, and the large villous size and those polyps who are firmly attached to the underlying lining mucosa, they carry high potential to become malignant. Moreover, high-grade dysplasia in a polyp, and also if its size is large, both of these are make the polyps to be highly susceptible for malignant transformation. Diagnosis of the adenomatous polyps is made by colonoscopy, and during the colonoscopic examination a biopsy is taken from the polyp, and then it is examined histopathologically, and if the polyps, if it is an adenomatous polyps, then the polypectomy is the treatment of choice, and as most of the surgeons, they remove the polyps to prevent the future risk of being their transformation into malignant tumors. So adenomatous polyps may occur sporadically, or they may be associated with some syndromic conditions. Usually, the polyps that are concerned with the syndromic diseases are those polyps that appear in the background of the familial adenomatous polyposis syndrome. In these diseases, the mutated genes are inherited, and the mutation that occur in the adenomatous polyposis coli gene causes uncontrolled epithelial cell growth. If the mutation is simply in the APC gene, then it would result in the form of an adenomatous polyp. But unfortunately, the tissue then accumulate and the cells accumulate further mutations, particularly mutations in the KRAS and P53 genes, and this is enough for the malignant transformation of the adenomatous polyp to become a colonic cancer. Familial adenomatous polyposis syndrome is a genetic condition. By that we mean that the child is born with the mutated Adenomatous polyposis coli gene that is inherited from the parents, and there may be so many polyps that they may range from 100 polyps to 1000 polyps. And in this condition, the treatment is total removal of the colon, because the polyps associated with familial adenomatous polyposis syndrome carry a high risk for malignancy, and it is said that 100% of the patients that are untreated and left with the polyps in their colon, they will develop the colonic cancer or colorectal adenocarcinoma. In this picture, we can see here a pedunculated adenoma, and in this picture the adenoma appears with a valvety surface. The symptoms associated with colonic polyps varies from patient to patient, but the most common symptoms are the rectal bleeding, and the stools, they appear as streaked with red blood, and sometimes the patient may complain of changes in the bowel habits. For example, the patient may suffer from constipation and diarrhea. Sometimes, particularly when the polyps are ulcerated and inflammation occurs, the patient may complain of pain, and the chronic loss of blood from bleeding ulcerated polyps may result in iron deficiency anemia. Thank you very much.